So welcome to our program tonight. The title is Vaccines, one of public health's greatest achievements. And I think that is very true, very apt, and we are just appreciating it more than ever these days. So we have Robin Vida from the St. Joseph County Department of Health here with us tonight. And Robin, I will let you take it away. Do you need to share any slides or anything? Do you want me to make you a co-host?
I don't think so. I don't think so, but I'll let you know if I do.
Yeah, just let me know.
Perfect. Yeah, no, and welcome to Alex and is it Karis? Maybe, okay. At first I thought it was Chris. I'm like, that's definitely not it. So as Sarah mentioned, my name is Robin Vida. I'm the Director of HOPE, Health Outreach, Promotion, Education at the St. Joseph County Department of Health. I've been there, just about 13 and a half years. And my role is largely education, outreach, primary prevention, media, social media, all those good things. So how do I ensure that the public is informed about things that are important to them? And as you can imagine, the last almost 18 months has been consumed by COVID-19. And we have identified, and a lot has come to light with the vaccine development. So this is our third session. So the first one we did, and forgive any background noise, I have two small children. They like see the teal headphones and like, that means mom must be like gaming or something. And they can go crazy. So the first session was just general Q&A around COVID-19, COVID vaccines. Last time we discussed specifically myths and facts around the vaccine. And today we're going to look at vaccines in more of a holistic approach. So we'll talk a little bit about traditional vaccines. We'll talk a little bit about the new COVID-19 vaccines. But really this is an opportunity for you to ask questions of me. And I will do my due diligence of answering those as correctly as I can. And rest assured, if you ask something that I'm not aware of, we will for sure find the answer. Because really knowledge is power. And we've seen, so we started our vaccine clinic in January. This is actually my second pandemic with the Department of Health. My first one was H1N1, which also we saw our way out of that. With vaccine uptake, a little bit easier to develop a vaccine since it was just a shift in the strain of the flu vaccine, which we'll talk a little bit about the flu vaccine because that's kind of unique and people are going to ask, probably are wondering, am I going to need a booster for the COVID-19 shot? What about the variants? All those types of things. So we'll talk about those things in context today. And then of course, I'm an informal speaker. So if you have questions, just type them away. Sarah will help me moderate them. Unmute. I'd love to hear your voice and ask away. I've been asked a lot of questions, but I really have seen how hearing the message over and over again really equates to less hesitancy. And tonight we're talking about vaccines as the greatest public health achievement. But last year, well, 2019, the World Health Organization actually listed vaccine hesitancy as one of the top 10 threats to public health across the world. So it wasn't just in developing countries or well-educated communities, it's across the world. And I think that's largely because of the way in which we get information can be skewed to whatever perspective we want to see, right? So it's hard to know what to believe or what to see. So that's where we work towards giving the facts, right? And the facts aren't always going to be exactly what the Department of Health wants. It's just how it is. It's not going to be exactly what the CDC wants or any other credible source of information. And I think that's okay, because that's our role. So a lot through the pandemic, um, I've been on both ends of praise and not so much praise for public health mitigation strategies such as the mask wearing and physical distancing and I don't even like to say the lockdown, but mainly the closing of places where people gather in an effort to control spread. And I think the one thing that people forget the most is the Department of Health. We have a dual role, not just protecting the health and well-being of our community, but also the health and well-being of our families. So there were times when someone would be screaming at me about something, and I would say, I'm a mom too, and I understand you're frustrated about school, and I am too, because now I'm talking to you from home rather than my office where I can think clearly or take a break, or you don't have a 1-year-old screaming. So it's all in context, and we've learned that people are extremely resilient. And I think the resiliency message can actually work towards vaccine hesitancy. Because when we look at what was the big culprit of vaccine hesitancy, largely was a false article by a credible source. And two things came out of that. One was the fact that people now believe that immunizations or vaccines cause specific conditions such as autism, which we will address that tonight as well. But then also, not a bad thing, but also just a thing that needs a little bit of work, is it allowed people to decipher the information, which I think is great. You should be informed before you're going to do something. Before, when the vaccine was first being developed for COVID-19, my husband will tell you, I was like, nope, I'm just going to wait on that. I'm going to wait and see. And I'm going to see what federal official gets it first, and then we'll go from there. And really, it was my own reading of the vaccine process. Why was the COVID-19 vaccine able to be developed so quickly? And really understanding all of those pieces that allowed me to feel confident in my decision to vaccinate when I was able to. And I've used that message quite a bit. And we have volunteers that will come that have no problem volunteering to give their time at the clinic, but are hesitant about the vaccine. And them seeing the process and hearing other questions and that type of thing has been really helpful for them. And several people have said, no, I've volunteered here enough. I'm gonna go ahead and I think today I'm gonna vaccinate, right? Because they're eligible, and I'm like, yes, that's awesome, right? Because again, that information is necessary. When we look at vaccines as a public health achievement, right? So vaccines do really one thing. They prevent severe illness. Sometimes they prevent illness altogether, which we are slowly seeing with the COVID-19 vaccines, as their early studies are starting to show that they do decrease transmission. So they're going to decrease the number of people that actually get infected with COVID-19. And the best thing that all three of them have done is they prevent hospitalizations, they prevent death. And that was really our goal when we looked at COVID-19 vaccines, is how do we ensure that people don't die? And really when we look at just vaccines, specifically for communicable diseases, which is a disease that's transmitted person to person, that could be through any sort of bodily fluid. Usually one of a few. So cough, sneezes, right? So the mucous membranes, your mouth, your nose. Some are bloodborne, so we have vaccines for bloodborne diseases. One of the key things that really got muted because of COVID-19 was they actually developed an Ebola vaccine. And they utilized the same technology, the mRNA technologies that they've used for COVID-19, which is actually huge because Ebola is super fatal and it's going to save lots of lives and the economy's lots of money. Okay. They're not going to have to, they're not going to have to shut down. They're not going to have to worry about controlling who's coming in and out, right? All those other ancillary things that we usually don't think about when we think of controlling a disease. Okay. So we know, so vaccines actually are relatively, I don't want to say newish, but they're only around like 220-ish years old. So a few centuries, but nothing too cray. And in that largely was based off of like the father of epidemiology, who was who identified that there was a germ theory that you could that people didn't just randomly and spontaneously get sick, but they were infected with something through either coughs, sneezes, water, those types of things. And when we look at causes of death, predominantly in the 18th and 19th century, they were communicable diseases, things that now are readily preventable unless somebody is severely immunocompromised or has some other health ailment, right? So we've shifted from communicable disease being the leading cause of death to chronic conditions, or we like to call them conditions of behavior, right? So poor nutrition, poor lack of physical activity, smoking. Really, if anybody wants to do anything to protect and make themselves healthier, it's to quit smoking. Hands down, the one thing that is just so detrimental to one's health and well-being. But then we saw that, I think it was right around 1830, and I cannot believe I'm literally blanking on his name. It wasn't Louis Pasteur. He was a founder for something else, and but the father of epidemiology, I want to say it's Salk, but I feel that's incorrect.
Is
but
his name John Snow?
Snow, thank you. I was like, it's not Salk. He came later. He was like, so John Snow, father of epidemiology, duh. Again, it's been a long day. But he discovered Broad Street. So in his town, he was seeing that people were dying exponentially when they would drink water from the Broad Street pump. So what he did is he thought, okay, all these people he made the connection that the water is what was making them ill. And he literally went and removed the pump. He just took the pump out, and miraculously people stopped getting sick. Okay. So it stopped. And that was like they call him like the father of epidemiology, where he investigated the problem, found this solution, and then mitigated to find a solution. And then there's like that's right when the germ theory was also developing, and people were deciding that we were identifying that things cause illness, not spontaneous things, which is interesting because if you talk to lots of high school students, they will think that things just pop up out of anywhere, and they don't make that connection that actually it's your hands or getting, your germs or things get into your nose, your mouth, and they make you sick. So almost all of our vaccine preventable diseases currently are communicable diseases, things that are passed from person to person, hence the need for the vaccine to control potential spread. I think of an example like measles, super contagious. We saw a measles outbreak about 2 years ago, so we're 2021, summer of 2018. And it was the worst measles cases we've seen in decades. And that was largely due to the number of individuals that had chosen to not vaccinate with an MMR, or a measles, mumps, and rubella vaccine, which is something very small children get. And vaccines are given in a series. And significant amount of doses based on thank you, Sarah. I knew it would come to me when you said it. It would largely the boosters are required for vaccines, largely because of vaccine weaning, or antibody weaning. So there are two of them to talk about. The first one's pertussis or Tdap. We give it its now a Tdap. Before it was just a tetanus shot, right? And I'm sure most of you are aware of a Tdap. And it requires one booster. So actually, small children to complete the series, I believe, get 4 DTaps. Okay, so tetanus, diphtheria, pertussis. But what we noticed and how we noticed, this was through epidemiology and surveillance, is that we were seeing cases of pertussis in individuals who have been vaccinated. And we were able to study and see that that was because the vaccine weaned over time. So they needed that booster to keep their body's army ready in the event they'd come into contact with pertussis, they would be able to fight it off. So that's one example that requires one booster. And as of now, that's all we know that it needs, one booster. Okay. If we look at the flu vaccines is different. And it's somewhat similar. We're going to equate it a little bit to COVID-19, but they are very different in nature. They're different in the way they're produced. They're different the ways. The similarity is that there may be a booster that's needed for COVID-19. But I guess the other similarity is they both are an injection. Okay. But when we look at the flu vaccine, flu is determined. So what month am I in? March. So this past February, lots of healthcare professionals, epidemiologists, scientists who study flu surveillance decided and predicted which flu strains would be circulating this coming fall. And we largely do that based on Australia. So Australia's flu, we follow Australia's flu season. So when we saw Australia in the summer having very low numbers of flu, we were anticipating we would see the same thing, right? So that vaccine uptake was exponential. I believe it was higher than years past, but really uptake with the flu vaccine really is only maybe 35 to 40% based on, and that's looking at the overall population. Okay. And each year, because of flu variants, right? So it'll be this strain, will be that strain. What happened with H1N1 is that was a novel strain. So a brand new strain. We'd already been vaccinating people for an H1N1 like virus. It was just the wrong strain. Okay. So this was a novel strain, and that's why that flu shot that everyone had gotten previously that fall wasn't super successful in protecting them. It was because it was a brand new strain. And that's why we see several flu seasons where there's very little activity, and then maybe we'll have another season where there's just record numbers of flu. And that is largely because we might have predicted poorly in February what strains would be circulating come the fall. Okay. And I'm not even necessarily, I shouldn't say but I haven't even necessarily found a conducive argument that flu vaccine weans. It's just you need the booster for the extra coverage of the 4 potential strains that are circulating. So that's why we give that yearly flu shot. Okay, because it's going to be the best protection. And I guess another way that it's similar to COVID-19 vaccine is the flu shot doesn't prevent the flu, it prevents death and severe illness. So individuals who get the flu shot may still get the flu. It's just a mild case, lasts usually anywhere from 2 to 3 days, and you don't feel like death has come over you. And I think that's very similar to what we're seeing with individuals who've gotten the COVID-19 vaccine and have been fully vaccinated, but they've still come down with either an asymptomatic case, so a case where they test positive, they have no symptoms, or they've had very mild symptoms, which we knew was potentially going to happen. I think as we go through more and more research and we get tighter and tighter on the variants that are circulating as it relates to SARS-CoV-2, the virus that causes COVID-19, our vaccine will just get that much better. Like if we think about it, Pfizer, Moderna, and even Johnson and Johnson, all three of them are already working on booster shots in the event that they would need to give something for those variants. And the variants are present because of the rate at which we had transmission. Transmission has been very high across the country. So millions of people for 16 months or so. Okay. First case was documented here in January. St. Joseph County saw their first case in March, just last week, actually. So when you have those high numbers of transmission, viruses, bacteria, any type of organism actually mutates every time it replicates, right? So you might get 99% of the virus will look just like all the others, but then you have that 1% that doesn't. And then when they cough and sneeze and they transmit it onto someone else, now they've picked up that potentially mutated strain. And then now maybe 5% of that virus that's replicating is now going to be mutated and so forth, right? And that's why they keep saying the vaccine is so crucial to controlling the variants, is because the more people we can get vaccinated to decrease transmission, the likelier we will be to control the spread of variants. Specifically in our community, we are aware that we have had tests pop up with the B117 variant that happened late last week. So that is the UK variant, the first variant that we were testing. And then there's two other, the South African variant, and then there is, I believe, a second UK variant that they are looking at. And people say, oh, I heard that it's more deadly, or it's more fatal, and really it's just transmission is quicker with the mutated form, the B117. So therefore we know that there's a disproportionate amount of individuals based on age and other risks that they're going to have more severe outcomes. So you would expect more people to die because more people will be transmitted. Okay. So that's that piece there. So also with the flu vaccine, it covers four different strains, and it is used where it uses a dead part of the virus to actually cause an immune response. So traditional vaccines would take a dead piece of virus or bacterium or a very weakened strain. I don't believe we have any live attenuated vaccines anymore, but we did for a little bit, like the nasal mist for flu. That was a live attenuated vaccine. It was called flu mist, and you were vaccinated that way. It went through your nostrils, and then you created an immune response. But if any nowadays are not live. But so dead virus, dead bacteria, something like that, cannot get in your body and cause disease, but your body will say, wait a minute, you're not supposed to be here, and it will mount a response. So in the event you actually came into contact with the actual virus or bacteria, your body's already have an army to stop it dead in its tracks, and you're not going to get sick. Okay. Or if you do, it's mild because you already had this immune response, and then your body's going to go into action, cause more immune response, and you're going to take care of it a lot quicker than you would without anything. So when we look at the COVID-19 vaccine, and again, why I think vaccines are, and I'm not the one who declared vaccines one of public health's greatest achievements. The Centers for Disease Control and Prevention actually did that, largely based on the number of lives it saved. Millions upon millions of children each year are alive because of vaccines. Think of the pneumonia vaccine that's given to older adults, the shingles vaccine, which the shingles as an adult is extremely painful. And somebody who's immunocompromised, they can get an infection in one of those scabs. And what if it's a staph infection, or what if it turns septic? All these secondary or ancillary things that can happen from what we may think is very simple, right? Oh, it's shingles, well, it's chicken pox, right? Big deal. But still, a lot of things go into that. But we've also seen the economic value of vaccines, which I hate always equating public health to a stronger economy or to money, because I hate people thinking that we've put dollars on their lives, because we don't. But when you think about, when you talk to lawmakers and you talk about vaccines, it comes down to saving the economy. How do we keep people working? How do we keep restaurants open? How do we keep kids in school? And there's no better example than for COVID-19, right? We've got kids still out of school who have not been in school since last March. And now we are seeing increasing rates of suicide, huge amount of food insecurity, while also reeling with racial and cultural and socioeconomic inequities. Okay. So it's really this mountain of storm. And I think when you look at vaccines, specifically based on science, science is either right or it's wrong. There's no gray area most times, right? It's either this is going to work, this is not going to work. I did my undergraduate degree in biology and chemistry. And then I double majored in gender studies. And it was very clear that when it came to science, it was a right or wrong. DNA is going to do this no matter what. RNA is going to do this no matter what. There was no ifs, ands, or buts about it. Could you manipulate it? Yes, but it was going to happen. Gender studies, if you argued your point well enough, you could be right. Okay. And I think that's the message that a lot of us have forgotten with science, is that it is black and white. And we research to identify better things because we know more, right? Think about, like I have type 1 diabetes, and and I have since I was a little kid. So I think I remember being in middle school having to draw up a syringe to give myself insulin, right? Well, now I have an automated pen, and it's super easy, super discreet, and it's just done, right? And my cousin also found out very young that she had type 1 diabetes, and she uses a pump. And that's research there. That's science saying, hey, this is what we did because we knew that, but now we know better, so now we're going to do better, right? And that's exactly what happened with some of the risk mitigation strategies for COVID-19, especially around like the mask wearing. And we didn't wear them at first because we needed to preserve them for medical personnel, that we just didn't have enough. That was a failure at the federal level, not planning, right? We were told we had all of this national stockpile, and we did. We just didn't have enough for 325 million people. And I think that's a big thing that we just need to be really honest with ourselves and say, yeah, we didn't have the means to do it. So we said, preserve these N95s for medical staff. And then as we researched it, we were like, wait, cloth masks actually do slow transmission. Oh, wait, now we're 6 months in it. Now we know actually the mask does more than just protect the person around you. It provides a little bit of coverage from you, right? So all these things we're just learning more and more about. And I don't think, I think eventually mask orders will lift. I don't think everyone will stop wearing them. I think some people will be like, oh, thank goodness I'm done. However, we've been able to control lots of other communicable diseases by mask wearing, by washing our hands, by being physically distant. And I'm not saying that that's great for mental health. And, you know, I think of my 6-year-old, right, who we worked so many years on, you know, hugging and being kind and you helping your friend when they're upset. And then this whole last year, I'd be like, don't touch anybody, don't go by anyone, you know, stay apart, don't offer them anything, you know. So again, all the things that I think we can retrain ourselves with when we just really look and say, this is what we know. And for that, we're really happy with. And I'm excited to see with new vaccines coming on, So Pfizer, Moderna, both are mRNA technologies. So as I mentioned previously, traditional vaccines utilized some sort of infectious agent to cause an immune response, where Pfizer and Moderna, they actually know what they need to tell your cells to produce an immune response. So it's messenger RNA, and it's strictly that. It tells the cells, hey, make this spike protein. I'm telling you, cell, to do this. And the cells do, and they do very effectively, very safely, even safer than traditional vaccines, because traditional vaccines, in addition to using an infectious particle, most times grow that somewhere that increases the chances of allergic reaction or adverse reaction. So flu shot, they say, are you allergic to chicken? Are you allergic to chicken eggs? Are you allergic to this? Are you, because that's the way they grow the flu vaccine. That's how they grow those infectious particles, so that they can then add it to a vaccine, and then you get injected and your body builds an immune response. So I think with the mRNA technology, and a lot of it comes down to really two things where people were the most hesitant. So one, the former administration was like, oh, it's warp speed, right? What does that make it sound like? You're doing it super fast, or you're just getting it done. Not the best name. As a communications person for the Department of Health, I probably would have not called it that. Nor would I have reported that it was unproven technology, which if you look back over the summer at several articles around vaccine development, they looked at mRNA technology as unproven. And it wasn't that it was unproven, it's just innovative. It's we're re-envisioning how vaccines can work for people. And I think what we will see is we actually see way less allergic reaction and adverse experiences, because it's telling your body to make it. But I think we'll also see a plethora of new vaccines in development, because we were able to figure out very quickly how we needed to keep that mRNA stable so that we could inoculate somebody with it, right? So Pfizer, it's ultra cold temperature. They believed it was this ultra cold temperature, like our freezers at like negative 80 degrees. We have to have like special gloves to pull it out, right? Which also is kind of scary to people. But in all honesty, that was just because we knew at the moment that was how we could best keep that vaccine stable. But now, as we've gone through several months and Pfizer's continued to do their research, follow up on the individuals in their original participant study, they've seen over 1 million people inoculated with their vaccine alone. They've been like, oh, actually, it can just be kept in a freezer, and it's not going to mess up the stability of it, right? And then we have the emergency use authorization by the FDA. So in 2 weeks, we're going to talk specifically about vaccine trials and what that means and what those look like. And no red tape was cut to get COVID-19 vaccines. Every single one of the vaccines that currently have emergency use authorization actually were stopped at one point or another to ensure vaccine efficacy and vaccine safety, because there were some believed to be adverse events that they had to study and make sure it was not a result of the vaccine, right? So even now, I believe it's Sweden is halting their use of AstraZeneca vaccine, which has not been approved here, but they are concerned that it causes an unnecessary blood clot. But so they have to halt it, and they have to investigate it and make sure, is this really happening, or is something else causing it, right? And then they'll research it, they'll figure it out, and they'll shift and they'll learn how to do that better. And I think that's key, that we are aware, because someone's like, oh, I didn't realize that all of the vaccine trials had to be stopped. And yeah, we have to investigate to ensure those things aren't causes of the vaccine. And I think about HIV. Somebody asked me this just the other day. They called me and they said, but this COVID-19 vaccine is so good. Why haven't they found a vaccine for HIV? And before I came to the Department of Health, I actually was an HIV/AIDS outreach specialist in Southern Indiana. So that was my first public health life, was in HIV and AIDS. And the thing with HIV is HIV mutates so quickly that the minute we find a successful vaccine, within a couple of months, it's not as effective. And that's just due to the virus, the nature of the virus. It's very smart with using somebody's body's machinery to produce more of itself. And I think eventually we will catch it. I know they've been looking at using mRNA technology as a potential vaccine approach. And yeah, who knows? It could be one of those things, but really that is the big culprit there as to why HIV has not been as easily abated as other diseases. So I've talked about Pfizer Moderna. The J&J vaccine is more of a traditional type vaccine. It utilizes a small amount of adenovirus that actually is kind of somewhat manipulated to cause the same immune response in the body to a spike protein. So the adenovirus is a typical common cold. Most people get them several times a year. And so it's not harmful, but they utilize it as a carrier. So that's what we use in the vaccine to inoculate to cause that immune response. And we see side effects, right? So side effects of vaccine are not adverse experiences. Some can be very rarely are there vaccine adverse reactions. What you are seeing when it comes to a sore arm, redness, achiness, small fever, chills, that's your body's immune response actually working. And I think, like, to myself, like, I have a 1-year-old who tends to spike fevers way more than my oldest did. And to me, fevers are scary. And my pediatrician will say fevers aren't scary. It's your body's immune system working. And it just knows that they're fighting off something. And you can either starve a cold or feed a cold, or starve a fever or feed a fever. And most times we starve the fever, unless, of course, my kids are acting malaised, or they don't feel well, or their whole demeanor is shifted. Then we go ahead and do Advil or something like that, right? So we're not taking away the fever, we're just mitigating the symptoms of the immune response. Okay, if that makes sense. That's why most times when the Advil wears off or the Motrin wears off, that fever is going to spike again, right? Because all we did was control it for a little bit, so you felt better. But your immune system isn't going to, that fever is not going to break until your immune system's fully done doing its job. And even when we look back, let's shift just for a second back to HIV. We see that, and this is so interesting because most people do not equate these two things. So HIV, we used to think lie dormant in someone's body, right? So, I have HIV and I didn't even know it, right? Not the case. We can tell a week after somebody's been infected if they're going to be HIV positive. Okay. The difference is one immune system is so powerful that on average, somebody who's HIV positive, their body will work 10 years to try to fight that illness to the best of its ability until eventually it will just lose. It will just lose. And that's why HIV medication and treatment are so important, because it helps the body with that extra oomph that it needs to fight off this very, very strong-willed virus. And I think that's the big thing. Whenever I talk ever about HIV, I like to make that connection, because even now when I do bloodborne pathogens training, people say, well, yeah, you can have HIV and not know it. You can have HIV and not feel it, because your body's doing a really good job at curbing it, or you might have mild symptoms, a headache here, or stomach ache there, and then you feel a little better because your body's kept it at bay for a little bit longer, then it eventually just can't do it. So I've done a lot of talking. Hopefully it was organized. In my head, it was organized. But let's open it up to any questions. I do know, I think, Sarah, you had sent me 2 questions, correct?
Yeah, those were when people registered. I offered for them to put in questions they had. So there were 2 that had the questions.
Oh, excuse me. So one of them was, is the vaccine safe? The answer is yes. The vaccine is very safe because it is utilizing your body's own machinery. And there's really nothing else in that vaccine except a fat bubble that carries the mRNA to the cell so that the cell knows it needs to do some work. So yes, the vaccine is safe. And then people say, well, how do you know that? You've only had it on the market for so long. And again, it goes back to the basic mechanics of virology, or the study of viruses, which utilize RNA and mRNA and that type of thing. So we're able to utilize those basic principles in knowing what's going to happen, because again, it's science, right? We know there's a definite outcome. So I think the only thing we don't know is, will we need a booster? Or will we get good control of the variants and we won't need a booster? And nothing will be able to tell us that until we keep just going through each day. And then the other question was specific about vaccine trials for kids. And I believe, so it is thought that children going back to school in the fall might be able to be vaccinated. Keyword there is might be able to. Pfizer and Moderna have enrolled several thousand children, ages 12 to 15, to see if their bodies do the same. Do they protect them from severe infection, which again, we know kids didn't likely get severe infection, but we did hear those one-off stories of, a 10-week-old baby that got infected and died. Okay. And so we do know that some of them, it's not at the rate at which we see with older adults, but still there's value there. And I'm not sure, I couldn't find anything consistent looking at for children under the age of 12. But we do see, surprisingly, very small children, early childhood age, so 3, 4, 5, and even up to 3rd grade are not as likely to transmit COVID as we see with older children. And I think that's largely because older children tend to congregate more with other kids. They play sports and they have all these other opportunities to be social, where smaller children are managed, I guess. I don't want to say controlled, but managed by parents who ensure that hands are washed and they can keep them away from people who are sick and that type of thing. So I think that's where we see that. And they're still trying to find out why that is. And so far, the only thing that has stuck all the way through the pandemic has been that they believe children have less receptors on their cells for that spike protein. So it just doesn't bind as well to them. But what we've begun to see with the variants are those variants have been able to mutate that spike protein and potentially make it more contagious for more people to carry it. And again, that's why we need to get control of those variants through the vaccine. Other questions that you guys have for me? Was this helpful?
This was super helpful. I don't think I have any further questions, but thank you so much.
You're welcome, Alex. Thank you for joining us. Sarah, any questions from you?
No, that was really interesting. I'm just surprised. I was just really surprised that his name was Jon Snow. just because of the Game of Thrones character. It just, I was like, it popped up. I was like, is this a joke? Is this a, somebody typed it into Wikipedia as a joke? But yeah, that was really interesting.
Oh yeah, that I can't believe I forgot it. I teach at ICE South Bend in their school of health sciences, and like my H327, like that is an exam question. I beat them to the ground with the broad straight pump, and so I'm like, oh my god, why can I not think of his name? And it probably just because my mind is
like, yeah. But yeah,
I'm so sorry.
okay. I think it's so interesting to learn the history of science, because you realize that we didn't always know these things. How did we figure these things out? Well, somebody was paying attention to the patterns, and that's still really the way that it works. It just becomes so much more sophisticated now. But
exactly, yeah, you just know more. And it's, I think was what is it, a Maya Angelou quote that says, do your best until you know better, and then do better. I think that equates to pretty much anything in public health. Because I've yeah, life, exactly.
Yeah.
Do your best, and then when you know to do better, you just do better, and you figure it out. Which I'm hopeful and thankful for all of the people working tirelessly to find medications that work for COVID-19 patients. When you think about it, we still don't have any real effective treatment. We see things that are better than other things, like the monoclonal antibodies, which is like an infusion that you can get. So it's like basically like a souped up vaccine that works really quickly. And that's been effective. We saw for a while the convalescent plasma worked, but now some studies are showing it doesn't work as great as they thought it did. But it might just be because the monoclonal antibodies just work better. So yeah, I'm hopeful we'll just keep figuring it out. When you think about it, I got this question a lot too over the course of the last several months, is if masks were so well for preventing disease, why don't we wear them during flu season? And a very good question, right? Yeah, why don't we? And it largely comes down to because there's an effective vaccine to keep people alive, and we know how to treat it. And we have actually two treatments now for two antivirals for flu, where we don't have that yet for COVID. They're close. I think come next fall we'll be closer. But yeah, at least we know the vaccine's here. At least not gonna make somebody die. And we've already begun to see that. We've reported, I think, 2 weeks in a row, no new long-term care facility infections. That's huge. Back in November, I think more than 70% of our death that happened in that month, we had over 100 deaths that month, were in long-term care facilities. So that was huge for their benefit. And yeah, we're just going to see, I think, cases continue to hopefully decrease as we continue to uptake the vaccine. Eligibility will open this week for individuals 45 and younger. So watch your TV screens or social media for the one that will come. And if you qualify, be sure to jump on and register. We have lots of vaccine appointments open at St. Hedwig's. And that was because we advocated for that much vaccine. We wanted that much vaccine because we felt strongly our community would want it. And they do. We're just seeing a little bit of lag with eligibility. And that's not based by, we don't decide that, the State Department of Health decides eligibility. So I think if we, going into the week, knew we would have several hundred vaccine spots open each day going into this week, Dr. Einters, our health officer, would have been like, vaccinate everybody, anybody who wants one, in an effort to make sure we got vaccine in people that needed it. So yeah, but I am confident eligibility will drop. And I'm hopeful that by the end of the month, we'll see huge uptake in who's eligible.
Awesome. Thank you so much for all of that great information. It is really, all of these have been so interesting, and we were recording this, so we will post that on our YouTube channel so anyone who couldn't make it can watch. Yeah, thanks so much
You're welcome. Thank you.
for
See you,
attending.
Sarah.
Thank you.
Bye.
Bye.